And welcome back to the morning show. Dr. Bellew, who has been a guest many times on the morning show. We're at Mohave Skin and Cancer. Good morning.
Morning, Bruce. How are you?
I'm well. How are you?
Great.
It's good seeing you. What's been going on?
So we're doing well at Mohave Skin and Cancer. Yeah. We're staying pretty busy.
That really bothers me. You know that. It really does. I get you guys successful and say, that's enough advertising.
No.
Oh, okay.
No, we like being on with you, and I like to talk about things to prevent skin cancer and getting checked out, because I think everybody, regardless of age, should have a skin exam once a year.
Yeah.
So I kind of want to talk to you a little bit about kind of the newest technology we have for detecting skin cancer, especially melanomas, at a really early stage.
Well, now this is about the time. I mean, you should have probably come out of summer and gotten examined to make sure you didn't have anything starting on you. But let's get started with the new year and get you in here so they can kind of go over and make sure that nothing is starting, because there's nothing worse than ignoring it, because it can cause a lot of problems down the road.
Definitely.
You got some new equipment and everything.
Yeah, I'm really excited about it. So Dr. Lott, myself, and Dr. Taylor, who's one of the new doctors that joined our practice, we just went to the 12th annual Dermoscopy convention that's at Mayo Clinic in Scottsdale.
The what convention?
Dermoscopy.
Dermoscopy.
So what dermoscopy basically is a handheld device that we can use to examine skin lesions and have a better accuracy than say just looking at it with your regular eyes.
Okay.
And so the technology that we have is fairly new. So there's a company called 3Gen that came out with this, what's called a polarized dermatoscope, in which we can basically look at the skin structures at a lower depth and be able to identify melanomas at a very early stage. The big dilemma with us when we see a patient is not so much when we see an overt melanoma, we know exactly what it is, we're going to remove it, but there's these moles that are kind of on the edge where they're not quite melanoma looking, but they're changing, and that change can be because of genetics, family history, from sun exposure, from sunburns, all these different things. And so, when we see these things in the office, oftentimes we'll remove them, but we don't know if they're melanoma or not. With this device, we can actually have a better diagnostic accuracy. And we can see the colors better. We can see certain signs underneath the skin, and it improves our ability to detect melanoma at the early stages, which is really what our goal is to get this at an early stage so people don't have to go to a surgeon and have lymph nodes removed and be on all these medications like chemotherapy.
Or even have chunks removed from there.
Absolutely, yeah. So we can identify, melanomas with this. We can identify squamous cell carcinomas, basal cell carcinomas, and it's a fairly new technology that not a lot of dermatologists are using yet.
Yeah.
But I think in the next 5 to 10 years, it's going to be revolutionizing this field. Okay. And so we're getting better and better at using this technology.
Well, not being shy to ask, I've got one I want you to look at.
Let's take a
Let's see if this thing really works.
So
this one just came up on me here a couple weeks ago.
Okay.
And I was just kind of wondering on it. Actually, I was going to get an appointment with you.
So what Bruce has here is he's got a small, it's probably less than a centimeter, and it's a raised lesion on the skin, and it has some scale to it. So I can see that it's just slightly red. So what I'm going to use is the dermatoscope. So basically, we'll turn it on. It uses a series of LEDs. And so what I'm going to do is take a closer look with this dermatoscope. And so with this, I can actually see that the scale is much more prominent. There's a lot of redness around it, and it's irregular. So it kind of has all these features that we don't like. Now, the good thing is it doesn't have pigment to it. So it doesn't have a black color underneath the microscope. It tells me it's not a mole. So, and it's not in the melanoma category. But you're down a different category, which we call non-melanocytic tumors. And because it's irregular under the dermatoscope, what I'm going to do is I would recommend freezing it. It looks like what's called an actinic keratosis. We can save you a biopsy by doing it this way and not have to worry about cutting into your skin. We can simply freeze it with a nitrogen, which we can do right now.
Well, let's do that then.
And what we'll do is we'll do just a little freeze here.
Okay.
Takes about 5 to 10 seconds. We do one little thaw one more time. And so what'll happen is that act of the freezing, which is about 200 degrees below zero, will actually cause a blister to form in the skin. And then over the next 2 weeks, it'll scab up, fall off, it'll be gone.
Yeah.
So the idea is we're thinking and we're looking at it under the dermatoscope. It tells us it's precancerous. It's only on the skin surface. The freezing will get rid of that skin surface. The skin will form underneath it, which is good skin. And hopefully we've avoided a skin cancer.
And I've just avoided a whole bunch of trouble down the road.
Yes, yeah, definitely.
That's so great.
Yeah,
I mean,
it's pretty cool.
We've been very fortunate. I've got quite a history with you guys. And
right.
Been very fortunate that over the years I've been able to come in and we've checked over regularly, and I think there's probably many, many times that I let it go, there would be some serious problems.
Definitely. Yeah.
So it doesn't, and you know, there's a little bite. I'm not going to kid you. There's just a little bit of bite to the icing of it, but overall, you look at that, and it's not totally uncomfortable, not by any stretch, but you look at that as opposed to having to come in here and sit for 4 hours while they keep cutting out, take that piece, make sure that it's not got all the cancer. Oh, we didn't get it. They go back and cut more and more and more. That saves you from all of that, and it's worth your time just to come in for a good checkup, get some of these things frozen over if you've got some. It's just all the difference in the world. What a great piece of equipment.
That's pretty neat. We're really excited about using it. And,
Now you aren't going out, you know, at night stuff. Hey, care for a drink? Oh, really? Hey, listen, let me take a look at it.
Well, people ask.
Not doing that yet, are you?
Well, not yet, but everyone, you know, when we see people out, and I've been asked at the gas station, they say, "Oh, you're a dermatologist. Can you take a look at this spot?"
Oh, I bet.
So, but now that we have this, we can actually have a better. We have more accuracy in our diagnosis, and we can also save people unnecessary biopsies.
Right.
Cutting on the skin, and we don't have to cause a scar that could potentially cause a problem down the line. So it's a better overall way to identify skin cancer and treat it.
That's absolutely great.
Yeah.
Well, doctor, thank you. Send me the bill on that one.
All right.
Good to see you again.
Oh, no, it's Reese.
That's Mohave Skin Cancer right here in Laughlin. Give him a call today. Come down and see him, and just get checked out. Even if you don't think you have anything, you just never know. We'll be back in a minute. Stay with us.